I'm Katie Garrod, I'm ward manager, previously on ward 17, the medical unit, and I've managed the ward for 7 years, but I've worked within the trust for 25. Most ward staff will be familiar with the system where the nurse in charge is the holder of the ward keys, which is a great big bunch of keys with possibly up to 20 keys open in different cupboards. The nurse in charge is responsible for holding those keys. So there's a lot of frustration when other staff are wanting to access the cupboards, finding the staff who's holding the keys, so there's delays in accessing medications. The keys often went missing. If a member of staff left the ward with the keys, then we were unable to access the drug cupboards. In a typical day we could spend up to an hour looking for keys. One of the impacts of the keys going missing is that the patients will have a delay in administering of medication, which could be antibiotic or pain-killing medication, which needs to be given at specific times during the day.
I'm Maid, I'm Clinic Director for Pharmacy and Medicine Management at North Lincolnshire and Rural Hospitals Foundation Trust. I'm responsible for the pharmacy department and all aspects of medicine safety within the trust. I've done some sums, and if we implemented the locking system across all our wards in the trust, which is 51 wards, I reckon the time saved from not looking for keys would be equivalent to approximately 24 nurses per day extra being on duty.
The old system was very difficult, obviously, with the staff sharing one set of keys. The new system means that they've each got their own key programmed individually to themselves. They can leave the ward with it and they can access any of the medicine cupboards, including the fridge, at any time during the day. Changes are always difficult, and the staff were initially reluctant to. The concerns were that if the software failed, then they would not be able to access the cupboards. However, that hasn't happened, and everything has moved along quite fluidly. There's been no problems. How many times during a working week does somebody leave the ward with the ward keys, or even go home with the ward keys? It happens frequently. It certainly did with our ward. And with this key system, it's not a problem. Everybody has their own keys, so there's always access to the cupboards.